Have you ever dismissed that aching knee or stiff shoulder as just getting older? Maybe you've told yourself that joint pain is simply part of aging and there's nothing you can do about it. Well, what if I told you that doctors are practically begging seniors to stop accepting joint pain as inevitable? I'm talking to you directly right now because this hits close to home for so many of us. Nearly half of all older adults suffer from arthritis-related joint pain, but here's what's absolutely shocking. Most of you are managing it completely wrong. And I don't say that to scare you. I say it because understanding what your joints are really telling you could be the difference between maintaining your independence and losing the activities you love most. Listen, I've been researching elderly health for years, and I've seen too many vibrant, active seniors slowly retreat from life because they believed joint pain was just their new reality. But that's not true, and today I'm going to prove it to you. I'm about to reveal 5 critical things that doctors desperately want every senior to know about joint pain. By the end of this video, you'll understand why ignoring that minor ache could lead to serious consequences, and more importantly, what you can do about it right now to reclaim your mobility in your life. Before we dive in, do me a favor, comment "My joints matter" if you're ready to take control of your joint health and stop letting pain control your life. And make sure to subscribe to Wise Elderly Tips, because we're about to change how you think about aging and joint health forever. Key Area 1. Joint pain isn't normal aging. Let me tell you about Margaret. She's a vibrant 68-year-old who absolutely loved her morning walks through a neighborhood. These walks weren't just exercise for her. They were her time to think, to connect with neighbors, to feel alive and independent. But gradually, knee pain made every single step feel like torture. For months, Margaret told herself, "This is just what happens when you get older." Sound familiar? I bet it does, because that's exactly what most of you have been told, either by well-meaning family members or even healthcare providers who should know better. But here's what Margaret didn't know, and what you need to understand right now. While some joint changes do occur with age, persistent pain, swelling, and stiffness are signs that something specific is happening in your joints. This isn't just wear and tear from living life. This is osteoarthritis, which is the breakdown of protective cartilage that affects specific joints due to actual wear and tear, not just because you've celebrated more birthdays. The biggest, most dangerous mistake I see seniors make? Thinking, "I'm just getting old," and doing absolutely nothing about it. This mindset, this acceptance of pain as inevitable, prevents millions of seniors from getting help that could dramatically improve their quality of life. Here's what I want you to do right now. Start tracking your pain patterns. Is it worse in the morning when you first get up? Does it actually improve once you start moving around? Does it get worse after you've been active all day? This information is pure gold for healthcare providers, and it's the very first step toward getting proper treatment, instead of just suffering in silence. Key Area 2. The 3 main culprits behind your joint pain. Now, imagine your joints as a well-oiled machine that's been working perfectly for decades. You've relied on them. They've carried you through life, and they've been incredibly faithful to you. But 3 different saboteurs can attack this system in completely different ways, and knowing which one you're dealing with changes absolutely everything about how you should respond. First, there's osteoarthritis, and this affects the cartilage that cushions your bones. Think of it like the shock absorbers in your car wearing out over time. Your bones start rubbing together more than they should, causing pain and stiffness. Then there's rheumatoid arthritis. And this one is particularly cruel because it's actually your own immune system attacking your joints, causing inflammation and swelling. It's like having a security system that's turned against your own house. And finally, there's gout, which involves uric acid crystals building up in your joints. This one often attacks suddenly and severely, usually hitting when you least expect it. Here's the critical mistake that too many people make. They assume all joint pain is the same, and they try the same remedies for everything. But treating rheumatoid arthritis like osteoarthritis, or vice versa, is like trying to use a hammer when you desperately need a screwdriver. It's not just ineffective, it can actually make things worse. Pay close attention to the pattern of your pain. Osteoarthritis typically affects your weight-bearing joints your knees, hips, spine, and it usually feels worse after you've been active. Rheumatoid arthritis often affects smaller joints like your fingers and wrists, and it affects them symmetrically. Plus, it causes morning stiffness that lasts more than an hour. Gout usually strikes suddenly in one joint, often your big toe, and the pain can be absolutely excruciating. Key Area 3. Red flag symptoms you must never ignore. Let me paint you a picture that might sound familiar. You wake up one morning and notice your knee is swollen, warm to the touch, and it's seemingly appeared overnight. Your first thought might be, I must have slept wrong, or maybe I twisted it getting out of bed. But this exact scenario, this dismissal of serious symptoms, sent one of my viewers to the emergency room when what seemed like a minor issue turned out to be a serious joint infection that could have caused permanent damage if she'd waited even one more day. Listen to me very carefully. Certain symptoms signal conditions that need immediate, urgent medical attention. Joint swelling combined with redness, warmth, and tenderness could indicate septic arthritis, and that's a medical emergency. Sudden, severe pain that comes out of nowhere might be gout or pseudo-gout, both of which require specific, immediate treatment. The most dangerous assumption you can make is thinking that if you can tough it out, it's probably not serious. I've seen too many seniors delay treatment for inflammatory conditions, and the result is permanent joint damage that's completely irreversible. Once that damage is done, it's done forever. Here's what I need you to promise me right now. Seek immediate medical attention if you experience sudden, severe joint pain that's unlike anything you've felt before. If you have joint swelling accompanied by fever, if your joints are hot to the touch, or if you suddenly can't move a joint normally, don't wait to see if it gets better. Some conditions worsen rapidly without treatment, and waiting could cost you your mobility permanently. Your joints have carried you through decades of life. They deserve immediate attention when they're crying out for help. Key Area 4. The mistakes that make joint pain worse. I want to tell you about Sarah, and I want you to listen carefully because this could save you months of unnecessary suffering. Sarah thought she was being smart. Whenever her arthritis flared up, she'd stay in bed all day to rest her joints. She figured if movement hurt, then no movement would help them heal. 6 months later, Sarah could barely walk to her mailbox. Her well-intentioned rest had actually made everything dramatically worse, and now she was facing a much longer, harder road back to mobility. Here's what Sarah didn't understand, and what you need to know. Complete inactivity leads to muscle weakness, joint stiffness, and actually increased pain. Your joints need movement to stay lubricated and healthy. It's like a door hinge. If you never open and close the door, the hinge gets rusty and stiff. But there's another dangerous mistake that's even more common. Research shows us that ignoring joint pain increases your fall risk by 53% if you have one affected joint, and up to 85% if you have multiple painful joints. When you're in pain, you compensate by changing how you walk, how you balance, how you move, and that puts you at serious risk for falls that could change your life forever. There's also the medication mistake. Many seniors think that if one pain pill helps, then 3 will help more. But overdosing on over-the-counter pain medications can cause serious side effects, especially for seniors whose bodies process medications differently. Here's what actually works. Stay gently active even during flares. Try simple range of motion exercises, just moving your joints through their full range of movement. Take short walks, even if it's just to the end of your driveway and back. Follow medication instructions exactly as written, and consider adding anti-inflammatory foods like leafy greens and fish to your diet rather than just relying on pills to manage everything. Key Area 5. The doctor-approved game plan for joint relief. Remember Margaret, who I told you about at the beginning? The woman who went from dreading her morning routine to avoiding her beloved walks altogether? Well, once she learned these evidence-based strategies I'm about to share with you, she didn't just get back to her morning walks. She ended up leading her neighborhood walking group. The transformation wasn't magic, and it wasn't expensive supplements or complicated treatments. It was simply following what research actually shows works for joint pain management. Effective joint pain management combines 3 simple but powerful pillars. First, appropriate medication. And this often starts with topical NSAIDs that you rub on your skin, combined with acetaminophen when needed. Second, regular physical activity that includes strengthening exercises for the muscles around your joints. And third, weight management if needed, because even a 5 to 10 pound weight loss can significantly reduce knee pain. But here's what most people get wrong. They think they need expensive supplements or complex treatments to manage joint pain effectively. The truth is, the most effective treatments are often the simplest ones. Physical therapy has been proven time and again to maintain and restore physical abilities in seniors with joint problems. The mistake that breaks my heart is when seniors avoid all physical activity because they're afraid of pain. But movement isn't the enemy of your joints, it's medicine for your joints. Start with just 10 to 15 minutes of gentle movement daily. Use heat for stiffness. A warm shower or heating pad can work wonders. Use ice for swelling. 15 to 20 minutes can reduce inflammation significantly. If you're overweight, I know this is a sensitive topic, but even small amounts of weight loss can make a dramatic difference in your joint pain. We're not talking about dramatic lifestyle changes, just small, sustainable improvements. Most importantly, work with your healthcare provider to create a comprehensive plan. Don't try to manage severe joint pain completely alone. You don't have to suffer in silence, and you don't have to figure this out by yourself. Let's be completely honest about something that doctors rarely discuss with you. Joint pain doesn't just hurt your body, it hurts your spirit. When simple tasks become monumental challenges, when you start avoiding activities that used to bring you joy, when you feel like your own body is betraying you after all these years, that emotional pain can be just as debilitating as the physical pain. But I want you to understand something crucial. Having joint pain doesn't make you weak, it doesn't make you old, and it certainly doesn't make you broken. It makes you human. More importantly, being proactive about your joint health doesn't mean you're giving into aging. It means you're fighting for your independence and quality of life with everything you've got. Your joints have carried you through decades of life, through raising families, building careers, creating memories, and living fully. They deserve care, not neglect. They deserve attention, not dismissal. And you deserve to live without unnecessary pain limiting your golden years. Choose one strategy we discussed today and implement it this week. Whether it's tracking your pain patterns, scheduling that doctor's appointment you've been postponing, or taking a 10-minute walk around your neighborhood, taking action today could completely change your tomorrow. Which of these 5 areas surprised you most? Are you dealing with morning stiffness that lasts for hours? Or is your pain worse after you've been active? Share your experience in the comments below. Your story might help another viewer realize they're not alone in this journey. If this video opened your eyes about joint health, subscribe to Wise Elderly Tips. We're here to give you the straight truth about aging well, backed by real medical evidence and genuine care for your well-being. Remember, taking control of your joint health today means protecting your independence tomorrow. Thank you for prioritizing your well-being, and I'll see you in the next video where we'll explore more ways to age gracefully and confidently. Stay strong, stay informed, and keep moving forward.